Living with neuropathy can feel like carrying a weight that no one else can see. The burning, the tingling, the numbness, the way it robs your sleep, it makes even something as simple as walking across the room feel daunting. If this is your reality, you know how frustrating and isolating it can be. I want you to know you're not alone, and there are therapies that may help. Hi, I'm Dr. Fabian Morales, and in this video, I want to share some of the highly recommended therapies I offer to support people living with neuropathy. My goal today is to educate you so you can feel empowered about the options available, understand how they work, and know what role they may play in your healing journey. Neuropathy simply means nerve damage or dysfunction. These are the nerves outside the brain and spinal cord that control sensation, movement, and even things we don't think about, like blood pressure or digestion. When these nerves become damaged, the symptoms can be life-altering. For some people, it feels like burning or tingling. For others, it may feel like constant numbness, electric shocks, or loss of balance in some cases. Muscles become weak, and everyday activities feel harder and harder. Neuropathy can be caused by many different factors. Diabetes is one of the most common causes, but can also result from chemotherapy, autoimmune diseases, infections, toxin exposure, nutritional deficiencies, and many other things. Sometimes we can't pinpoint a clear cause at all, but regardless of the source, the important message is this: neuropathy is real. It is not just in your head. There are steps we can take to help protect your nerves and improve how they function. When it comes to treatment, I use two guiding principles. First, we want to protect and preserve the nerves you already have. Second, we want to improve the environment around those nerves so they have the best possible chance to heal and function. That means addressing the root contributors, like nutrition, circulation, or even inflammation, while also incorporating therapies that have been shown to support nerve health and regeneration. Let's go through these therapies in more detail. Regenerative medicine is one area where we've seen exciting possibilities. One option is platelet-rich plasma, or PRP. This is created from your own blood, which we process to concentrate the platelets. Those platelets are rich in growth factors, the natural signals your body uses to stimulate healing. When injected around tissues affected by neuropathy, PRP can help improve blood flow, reduce inflammation, and send signals that encourage repair for nerve fibers. Another approach that may be considered in select cases is stem cell therapy. Stem cells are unique because they release powerful healing signals that can calm inflammation and potentially support regeneration in areas that are otherwise slow to repair. It's important to be clear, these treatments are not miracle cures, and they are not right for every patient. But when chosen carefully and integrated into a broader care plan, they can make a meaningful difference in pain, sensation, and overall function. Another therapy we use is Softwave Shockwave therapy. This treatment uses acoustic waves, basically pulses of sound energy that penetrate deep into the tissue. These waves stimulate blood flow, increase circulation, and trigger the release of natural healing chemicals in the body, such as growth factors and nitric oxide, which help with blood flow. They also activate stem cells already present in your body and can calm down chronic inflammation. The treatment itself is non-invasive. Most people describe the sensation as tapping or pulsing on the skin. Sessions are relatively short, and the benefits build over time with repeated treatments. For many patients with neuropathy, shockwave therapy helps reduce burning pain, restore some sensation, and improve mobility in daily life. Red light therapy, also called photobiomodulation, uses specific wavelengths of red and near-infrared light to stimulate the mitochondria. These are the power plants inside your cell that generate energy. Nerves require a tremendous amount of energy to repair themselves. When the mitochondria aren't functioning properly, as is often the case in damaged nerves, the healing process is much slower. By shining targeted light on the affected area, we can increase energy production in the cells, reduce oxidative stress, and improve blood flow. This therapy is safe, painless, and non-invasive. Over time, many patients notice that their burning and tingling sensations calm down, and in some cases, nerve function itself improves. It's a way of giving the cells extra energy so they can do the work of repairing. Nerves also rely on very specific nutrients to function properly. When the body is deficient in these nutrients or under extra stress, it can worsen neuropathy. That's why vitamin therapy is such an important piece of the picture. B vitamins are especially critical. A deficiency in vitamin B12, B6, or folate can directly cause or worsen neuropathy. Vitamin D and magnesium are also essential for healthy nerve conduction. Another nutrient we sometimes use is alpha-lipoic acid, a strong antioxidant that has shown promise in reducing nerve pain and improving nerve function. In certain situations, oral supplements aren't enough. That's when we may turn to intravenous vitamin therapy, where nutrients are delivered directly into the bloodstream. This allows us to bypass the digestive system and provide higher doses that the body can use immediately. The key is personalization. Through lab testing and careful medical history, we identify which nutrients your body actually needs, so we're not just guessing or overloading you with unnecessary supplements. Hyperbaric oxygen therapy involves breathing pure oxygen inside a pressurized chamber. Under these conditions, your blood can carry oxygen at much higher levels than normal, and that oxygen reaches deeper into tissues, even areas with poor circulation. For people with neuropathy, this can be valuable because oxygen is critical for nerve repair. Hyperbaric oxygen therapy helps improve circulation, reduce inflammation, and encourage new blood vessel growth. It also supports tissue healing in places where oxygen supply has been limited. It's a non-invasive therapy, though it does require multiple sessions to see results. And like all therapies, it's not suitable for everyone, so screening is important. But for the right patient, hyperbaric oxygen can be a very supportive treatment. I want to be very clear that no single therapy is a cure-all. Improvement with neuropathy is usually gradual and requires consistency. We track progress in ways that are meaningful: less pain, better balance, an ability to walk longer distances, and overall improvement in quality of life. The best results come when therapies are combined with strong lifestyle foundations. That means eating a nutrient-rich diet, managing blood sugar when it's relevant, engaging in consistent but gentle movement, getting restorative sleep, and reducing stress. It's this combination that gives the nervous system the best chance to heal. If you're living with neuropathy, I want you to remember that small steps matter. Adding a daily walk or a few gentle foot exercises can make a difference. Choosing whole foods like lean proteins, vegetables, and healthy fats creates a better environment for nerve health. And even simple changes in routine can begin to shift how your body feels. These lifestyle steps, combined with therapies like regenerative medicine, Shockwave therapy, red light therapy, vitamin support, and hyperbaric oxygen, can give your body the support it needs to heal. Progress may be slow, but it is possible, and you don't have to face this alone. I hope this video has given you a clear picture of what neuropathy is and the therapies that may support healing. If you found this information helpful, I encourage you to subscribe to this channel, like this video, and hit the notification bell so you'll be notified when I share new educational content. I'm Dr. Fabian Morales. Take care of your nerves and take care of yourself. I'll see you in the next video.